Okay, I think we will get started. Hello, everyone, and welcome to our workshop today, which is how families and providers can access resources through Vermont 211 and Help Me Grow Vermont with Margaret Armstrong, 211 Contact Center Manager, and Elizabeth Gilman, Help Me Grow Program Manager. All of our workshops, including previous ones, are recorded and can be watched on our VFN YouTube channel. The link is on our website, which is vermontfamilynetwork.org. Everyone who registered for today's workshop will receive a follow-up email with a link to this recording and a PDF of the presentation with live links. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. Today's workshop is being recorded, so please keep that in mind as you share information about your situation. This session will include live captions. If you want to turn them off, click on Live Transcript, then Hide Subtitle. If you are comfortable, you are welcome to turn on your camera. You can ask questions using the chat box, which you'll see at the bottom of your screen. Feel free to share information or links to resources that you have found helpful in the chat as well. We know that you can learn a lot from each other. So I'm excited to introduce you to Margaret Armstrong and Elizabeth Gilman. Thank you so much for joining us today.
Thank you. Thank you all for joining us, and thank you, Jamie, for the introduction. My name is Elizabeth Gilman. I'm the program manager with Help Me Grow Vermont. And today we're going to talk a little bit about the different services that Vermont 211 as well as Help Me Grow can offer, how we as two separate programs work together, how our programs support the families and the individuals that you serve, and how we can help support you in your work, as well as how to access our online community resource directory through the Vermont 211 website. So we're going to get started with Help Me Grow. To talk a little bit about Help Me Grow, this is our mission statement and our strategies that we use to connect all Vermont families who are expecting and have children through the age of 8. We do this by working closely with our partners, and at the Help Me Grow Resource Center, our main partner is Vermont 211. We also do a lot of work with Building Bright Futures, Let's Grow Kids, Vermont Family Network, and the Vermont Child Health Improvement Program. Our goal is really to support not only families, but their service providers with being able to support their child development, understanding how to do developmental screening and monitoring, making sure that families in need are able to connect through a reliable grid of resources and able to access those resources and provide that care coordination and follow-up around those resources and that connection piece. We're going to talk a little bit more in a bit about what that means. But to kind of give an overall bigger picture of how Help Me Grow Vermont helps to align Vermont families, this is a chart that kind of explains that all of these practices kind of use that two-generational approach. So there is home visiting, which really does that parenting support and education. There are partners in pediatric offices that help connect families to referrals, as well as doing that developmental screening. There are early educators, both in childcare settings and universal pre-K settings, that are using that developmental screening tools and monitoring. And then, of course, at the core of that is Children's Integrated Services in Vermont. They're really that main agency that everyone refers to really give that extra support to those families in need when children are experiencing some delays or developmental difficulties. And through all of that is Help Me Grow. So we're really trying to support all those different agencies and entities to help strengthen and support children in Vermont, as well as ensure that all children are being screened and they're being referred to the appropriate services for the best outcomes in their development. So at the Help Me Grow Resource Center, Some of the things that we can help support families with is answer their questions about their child's development. There are a lot of families out there that have questions. They don't necessarily feel like there's a concern, but they're just not really sure if what they're seeing and experiencing is typical of other parents. And we really are able to kind of offer that support to families. When it is a concern, we can offer developmental screening tools for the family using our ASQ online, which is the Ages and Stages questionnaire, and then also help connect them to those higher end needs like children's integrated services or programs through their local public school system. We can help them track and understand their child's development, not only using those developmental screening tools, but also looking for their child's milestones using materials through the Centers for Disease Control and Prevention Learn the Sign, Act Early program. We offer a care coordination piece to that work. So we're able to work with families and also connect with those people who are supporting that family to make sure that everyone is on the same page and everyone knows where that family is seeking services so that that family can go to anybody for that support. Part of our work in doing that is making sure that we have an up-to-date resource database. So we're going to talk a little bit about how that works with Vermont 211. We are really, because 211 is such a strong partner with Help Me Grow, we really kind of have a database within their database. So not only can we access the services and resources available to 211 staff, but for families, we also have some specialized services that we can offer, which includes resources to therapists who specialize in perinatal mood anxiety disorders, as well as therapists trained in specific modalities for children who've experienced trauma. This database is kept up to date by a resource team, and it covers not only state and local resources, but some national ones as well. So we're really able to provide that to families as well as people who are serving and supporting families to make sure that they have that up-to-date information. And then that care coordination piece is us really making sure that families are followed up with and able to connect. In addition to this, we also provide telephonic interpretation services and often promote the translated Learn the Sign, Act Early materials that Vermont Family Network has had translated into other languages. Every caller and every family that contacts Help Me Grow, we screen for developmental, we offer developmental screening, but also screen for social determinants of health, specifically using the hunger vital sign to screen for food insecurity. We believe that everyone should be screened for both, that is a best practice and it should happen in multiple settings. In addition to using the hunger vital sign, we also informally screen for other needs. So we sort of see that as a tool. If every family is screened using the hunger vital sign, it opens that door to those other conversations. If the family identifies as having some concerns about food, we know that there's a greater potential that they also have concerns about other basic needs like rent or childcare or transportation. We screen everybody because that universal screening really reduces that stigma around identifying as having a need, which can be difficult for families to discuss. And then we use that to support families around their other greater needs. So how do you reach us? There's multiple ways that folks can reach out to Help Me Grow. They certainly can call us by dialing 211 and choosing option 6. Help Me Grow is available Monday through Friday from 8 to 5. If somebody contacts us outside of those hours, they're welcome to leave a confidential voicemail with us and they'll be contacted the next business day. They can certainly text us as well. We have two-way texting. We have a lot of families who prefer to reach out to us that way. Or they can email us using our email account, which also is HIPAA protected. So any information shared about children is kept protected. And we have an online referral form where any service provider is welcome to complete. One of the nice things about the referral form is it then puts that responsibility on Help Me Grow to do that initial outreach. We understand and acknowledge that for some families, especially families under stress, it can be very difficult for them to take that first step and reach out. So if someone refers to Help Me Grow, we're the ones who will make that first step in initial contact with the family using any of the above modalities that they're most comfortable with. It also is an opportunity for us to close that feedback loop. So for any family that's referred to us, we always ask that family if it's okay for us to then contact that referring person to make sure that they know what we discussed and what resources we've talked about and what the plan is moving forward. This is an example of one of the things that happens when somebody reaches out to us using the referral form. And this is one of the 3 main ways that people can connect families to Help Me Grow. So when a family identifies a need or concern, that provider can, with the family's consent, make that referral. We will then reach out to that family, offer those supports, and have a conversation about resources and needs they might have, and then follow up with the provider to make sure that they know what we're working on. It kind of keeps going too. It doesn't have to be just one time around that loop. Sometimes we follow up with the provider, let them know, and then as we continue to work with the family, we continue to check in and ask, have you told your pediatrician that this is happening? Would you like us to reach out to the social worker and let them know? Whatever the case may be with that family. One of the other pieces that I'd like to mention is that a family that is working with Help Me Grow and receiving care coordination, it's a voluntary service. We also will work with that family for as long or short a period of time as that family feels they need our support. We're happy to then, if the family feels that they're all set and they're connected, keep that door open for that family to come back to us if down the road they have another need or another concern that they're looking for support around. So it's not a service that has a limited time, and it's open to all Vermont families with children 8 or under. So it doesn't have to be families that necessarily have a child who they have a developmental concern about. It doesn't have to be a family within a certain income range. It's really open to all Vermont families. And on our website is where you can find our referral form. You can either print it and fax it to us or download it and send it electronically. Another way that providers can connect with Help Me Grow is they can call Help Me Grow directly instead of sending the family to us and get those resources and services that they can pass on with the family. We understand that there are certainly families that have developed strong relationships with some of their service providers, and we want to protect that, and we want to make sure that that stays intact. So if the best way for a family to get resources is for that service provider to reach out to us, we're happy to work with them that way. And again, we can provide a broad range of services for that family, from basic needs to some of those mental health supports, as well as family supports around parenting classes, play groups, and recreation programs. Another and final way that a family could connect with Help Me Grow is they can certainly contact us directly. We, in 2020, received over 1,763 calls from individuals and service providers, and we're able to provide over 2,000 referrals to those families. And as you can see, these are some of the top needs that we're seeing. I'm sure that folks in the audience can identify with some of those needs that the families that they serve are experiencing. So to talk a little bit more about the developmental screening tools that we use, we, in addition to having the Help Me Grow Resource Center, a piece of that work is really about a centralized training and technical assistance center. We train medical providers, nurse and home visitors, early educators on using the ages and stages questionnaire online. We offer them an opportunity to use that online system for free to make sure that that universal developmental screening is happening across sectors. And again, when we screen all children, we know that we catch those children earlier and the outcomes are more positive for those children. And certainly if anyone in the audience is a medical practitioner or an early educator and would like to learn more about how they could use the ASQ online system through Help Me Grow, we're happy to talk to them and connect with them about that. So that in a nutshell is Help Me Grow, but so we're going to make a little transition here to Margaret, who works for Vermont 211. And to do that, I thought I would just talk a little bit about what our workflow looks like, because as you saw on the previous screen, to reach out to Help Me Grow, you dial 211 and choose option 6. So when folks call Vermont 211, they hear a system that gives them several options, and one of which is to choose option 6, in which case they transfer directly to Help Me Grow. Another is to choose extension 5, and extension 5 will be answered by a 211 staff person. So sometimes people either get confused or don't make the right choice or aren't sure which choice to make. And this kind of gives you a little idea about that workflow. So if a caller calls 211 and chooses extension 5 and gets a 211 staff person, they're asked the question if they have a child 8 or under in their household, or if they're pregnant, or if they're working with that family. And if the answer is no, then the 211 staff helps them. If the answer is yes, they transfer them over to Help Me Grow. So it's a very smooth process back and forth that kind of enforces that no wrong door approach. And the reverse happens if somebody accidentally chooses option 6 and they don't have a young child in the household, we would transfer them back over to 211. The only exceptions to these are in the springtime when folks are looking to schedule their Vita tax appointments, or if it's after hours or a holiday and a family is contacting 211 for emergency housing through the state of Vermont. And on that note, I am going to pass it on to Margaret. Oh, look at this. I didn't realize Margaret had such fancy slides. There you go, Margaret, it's all you.
Margaret, you'll have to unmute.
Sorry about that. Thanks, Jamie, and thanks to the Vermont Family Network for inviting us today. Elizabeth, I'm always in awe about the work you do, and I'm just proud to be a part of it with you in partnership with Vermont 211. Today, I'd like to just talk a little bit about our services, how to get connected to us, the work we do, and Elizabeth just explained very well about how we work together and how we're able to connect families, anyone, basically to services to help Vermonters. And we're here to also help serve the families that you work with too. I thought maybe we'd talk a little bit of how you can connect with our services, either contacting us directly or using our community resource database. But I thought it was important to maybe talk a little bit about who we are and how we're grounded in our vision and mission every day here at 211. We are part of a national 211 network. We're the only 211 in Vermont. And we work to strive to provide all people in Vermont with access to community resources, information, and referral. This access includes personal assistance by telephone or dialing, an online searchable database of our services. And so we might kind of overlap about how to connect. Elizabeth talked a little bit about how to get in touch with us. But the bottom line is that we are here, one call at a time, to help anyone who needs help or access to resources in the state of Vermont. We are here to promote the health and well-being of all people in Vermont through a statewide information and referral system for streamlined access to community resources. So Elizabeth, if you could just go to the next slide, please. And again, we are here to help 24 hours a day. You can call us, you can dial us from anywhere in Vermont, toll free, or from outside of Vermont. You can email us directly. Our email is monitored Monday through Friday, 8 a.m. to 9 p.m. And you can access us by texting us Monday through Friday from 8 to 10. There is a group of committed community resource specialists here to pick up that phone, to answer that email and to answer that text anytime during the day to help you get connected to resources. Anyone can contact us. You as service providers can call on people's behalf. Elizabeth mentioned sometimes it's really hard to make that first call to reach out. Things are overwhelming. It's hard to ask for help. You can always access us by calling with the client with permission or with the family member. We are here to work with anyone and everyone who is struggling or needs information and helping them to navigate the service system. We're person-centered, we're non-judgmental, and we remain anonymous. And I like to hope that there's a relief when people call us. It's that they pick up the phone, that someone's there to pick up the phone. There's a real person offering real help and making that real connection to help connect and problem solve and make some significant, hopefully good person-centered changes to improve the quality of their lives. Next slide, please. So this again is just kind of one of the values, to kind of focus on the value of calling us or contacting us. They can call anywhere in Vermont and to speak with a real person. We have trained community resource specialists. We are part of a national network. We're grounded in the AIRS standards for call service. We provide accurate, detailed, and up-to-date information about community resources in Vermont. The information we share is vetted. It's been highly researched, and people can count on the information that we're providing. We're also here as a contact for crisis. If people are calling and they're either suicidal, we're connected to the National Suicide Prevention Line. We're that first person that they reach out to when people are struggling or in crisis. And we're here, we're trained, and we make sure that people are provided that level of support. We also work with a number of partners to provide contact-specific data. We work with other agencies, state agencies, local programs, so that we have streamlined access to information. We're not having people get frustrated or having to struggle with being referred to agency after agency. They can contact us, and we are able to get them connected to the resources that they need in that moment. And that can be hard to navigate. So there's a real value to calling us or emailing us or texting us. Having someone pick up that phone who's providing that empathetic ear, who wants to listen and support and help problem solve and navigate what maybe potential next steps are. So there is, again, grounded in the work we do, that we are here to pick up that phone, that they're going to talk with someone, they're going to make a real connection and get real help in that moment. Next slide, please. How do we do the work we do? How do we connect people to resources? Again, we have a highly trained community resource specialist provided with very intense training about how to establish rapport with the caller, to ask those questions, those important non-intrusive questions that help the caller understand and identify their needs that they're having. And then we work to problem solve and establish next steps. And that usually involves, again, with high sensitivity and empathy, using a lot of active listening kinds of techniques and tools to help the caller identify what their need is and to empower them with information and referral. The process and the procedure for information referral is what we do every day. Again, we match resources with the need. We identify potential barriers to access. People are faced with and real challenges to being able to access the types of supports that they're looking for. It could be any number of barriers, but we, in a non-intrusive, non-judgmental way, we help the caller to identify that and to try to problem solve and to help them, empower them to know that there are real options out there to help them get the support they're looking for. We provide information about options. We use a database that's vetted through the Web Refer. It's a national ReferNet database that's used not only by us, but Help Me Grow uses it. Other 2-on-1s use it as well. We problem solve alternatives. We try to open up and look at the need in general, try to find out maybe if a caller is calling for one specific need, we might identify some alternatives to helping them problem solve. What other things are they looking at? What other types of supports do they have? Any natural supports, family, community members? What have they tried? What other ways can you be looking at the situation? What strengths that do you already have that you might not have tapped into, and to think about how to access other alternative means to get connected to resources. We do offer follow-up and ongoing support. We offer, with permission from the client, if it's okay, if they might be open to having us check in with them to make sure that they were able to access the resources that we talked about and offered. If not, what got in the way, and maybe just another approach, another attempt. A lot of what we do is try to empower and encourage the client not to give up. Next slide, please. One of the tools that we use to help people get connected when we're working with them individually on the phone is we use our database. It's something that there's a value to that with working with someone on the phone. There are over 1,000 agencies with 10,000 services across 3,000 programs linked to that database. It can be overwhelming. We are in that database every day. We're trained, and that's what we do. So working with someone individually or with another program or provider, we can help navigate that and maybe do it a little bit more effectively and efficiently by making, and also at the same time, making a real connection with a real person. But another way to get connected to our community resource directory is online. That is another option. You can go to www.vermont211.org. And we have access to the community resource directory that's maintained, again, by our database curators. They're trained in the taxonomy, and they keep the information that's provided in our database updated regularly. To search the 211 database for resources serving your area, you would need to tell us a little bit about the person seeking the service, where they're located. But you can also access the database by going to the resource tab, the drop down at the top, where you can also, there's a tab to click here for our community resource directory. But typically you can find resources in the area from the client that you're working with or the person who needs to support themselves. It's a fairly straightforward website. You can see that people can select the icons for a category research. You can click certain icons and they will drop down service terms. They have subcategories that will talk about basic needs. So you can see by the icons, or maybe not, but directly we categorize them by basic needs. That would include things like consumer services, education, healthcare, income support and employment, and individual and family life. People can access resources through mental health and substance abuse services. So people would just click on a category and a list of service terms appear as subcategories. And I think that's demonstrated on the next slide. So for here, we just used an example of COVID-19. If someone were to select on the COVID-19 tab, it would drop down different service terms that would break down the information and categories and access to resources in different subcategories. And people can just select on the subcategory and pull up resources and information about how to connect to those services. The taxonomy will break it down in terms of the name of the service. People can easily select that. It will give information such as the type of service that they deliver, the area that is served, any information about eligibility requirements, also contact information, phone number, address, things like that. Next slide, please. So again, we used homelessness, and when you select, this is a keyword, you can use another type of search, would be a keyword search. That's another way to access programs and services in the database, aside from the category. You can just type in the service needed or the need presented. And in this one, it's just another example of someone were to type in homelessness. That would describe the type of service needed. It will drop down different programs and subcategories as well. Things like for homeless drop-in centers. There is information about homeless shelters, homeless prevention programs. And people can search and click on one of the drop-downs, and again, it will pull up different resources available. And maybe we could just go to the next slide.
Margaret, did we lose you?
Type in the agency or program name. You would need to enter the complete name. And it does not filter by zip code. So it would not necessarily search the entire database for it would by the zip code. It would attach it to the actual agency. The types of agencies that are in the database would be things like federal and state local entities, community action agencies, nonprofit agencies, and out-of-state entities that offer services to Vermonters. In this example, we have COTS. In the prior screen, we typed in a keyword like homelessness. And so this is, if we knew that COTS is an agency that helps support people who are currently homeless. If we knew that, we could type in COTS directly for a way station shelter. In the prior screen, if we typed in homeless, the drop-down would be a little broader. It would say things like homeless shelters. There are lots of ways to access services, a lot of different ways to use this database to connect with different services and programs. So whether you use a category, a keyword, or an agency or program, it should readily get you access to different programs or searches or services or agencies to help people get their needs met. Elizabeth, do you want to just maybe go forward with another slide? Again, these are ways to get a hold of us. Yeah, you can contact me directly or Angela LaPointe. She's the other contact center manager. I'm hoping that this was just a very general, broad look at how we provide services and how you can contact us. But I'm hoping that that we're able to kind of present to you that anyone can contact us at any time. And there are a lot of different ways to get support. There's a real value in contacting us directly with trained specialists on that phone. We can individually tailor to the needs of the specific caller's situation. And we might be able to explore other alternatives and other approaches to help them navigate different systems and agencies and help empower them with the options that are out there. Another way would be to go directly to our website to research different agencies and programs that are available. And so there are many different ways to get a hold of us. And I just want to encourage people to know that they can call anytime, and we're here to help and support them. Next slide. Yep.
Margaret, I think that back a bit, you cut out a little. And so when people were seeing the screen with COTS on it, they maybe weren't sure how you got there. Could you explain the difference between searching for an agency and searching for a keyword again, just so that folks have that information?
Sure. Would it be helpful to go back in the screens to find that particular one?
I can go back, sure.
So when people are using our database online at our website, and people are selecting to help find resources or to connect with our community resource directly, there are different ways to search. You can do a category, which is the broadest, food, just a very broad search. A keyword might be a little more targeted, might be a little more descriptive of the service they need. And then the actual search by agency is if you have knowledge of a particular resource that's out there that could be helpful, you could use the name itself. So in this case, we used COTS. We were looking, if someone were looking, if they were currently homeless or supporting someone who is homeless, they could do a keyword search with homeless, which would drop down a broader base of particular potential resources. And it would open it up to potential services or agencies in their area. If someone is knowledgeable of the type of resource that they're looking for, they know the name of the agency or program, they can type it in as a category search. The thought here is that there's a broad way to find and connect to different resources through our database. It can be a broad search, like a category, selecting one of our icons or just typing in, or using more of a keyword. It might be a more focused term or more targeted term around a type of need, homelessness, food, and then the actual agency search. If you're aware of the name of the agency that you're looking for or trying to connect with, you can do a name search and just type the name in general. In this example, we used COTS. And I'm sorry if I was breaking out. I'm hoping that that clarifies. But if you see and look at this particular description, you'll see how the information is presented and how it's shared. It says the name of the agency, the address, contact information, who is served, the geographic area served, the actual service description, what this agency does, and how they can support, and how when you call or ask or identify a particular need, how this particular description could help meet your need. Informing and educating the caller and letting them know how this makes sense and why it makes sense. We're not just saying call COTS. They'll help you. This is what they do. This is how they can help support you, and how it makes sense that this could be a potential resource for you. How to apply, particular eligibility criteria, and any relevant notes around the programming. Things about after hours intakes or scheduling changes or requirements about how to apply and when to apply and how their service is provided, and contact information, accessibility needs. It's all there to help the person who needs the information or access to the program understands what they do, who they serve, and how to reach them, and whether or not this program, it might be something that they, if there are potential eligibility guidelines, they can assess whether or not it makes sense, that it would be something that they may or may not potentially qualify for, and how to get connected. So they have that information in front of them, and it gives them a leg up to make that informed decision about whether or not it makes sense to contact them. One nice thing is that this could be a little overwhelming if people in need are searching on their own. By reaching out and calling us, we talk about the programs. We talk about all of the information that's in front, and we try to empower the caller and inform the caller to help them make that next step to reach out. Does this make sense? Is this something that you think might be a good resource for you? Would you like that phone number? Would you like information about how to contact them today?
I think I would just like to tag on to that one quick thing, Margaret, that if a service provider reaches out to either Help Me Grow or Vermont 211, that resources can be shared not only verbally, but either via text or email. And when someone receives a text or an email with a resource in it, they get all of that information as well. So if you have a family that texts us, they're going to get a text, and the link when it opens up will be all of that robust information, not just a name and phone number.
Thank you, Elizabeth. That's correct. That's right.
Great. Well, thank you both. I think we will open it up for questions if that's okay. And I've been monitoring the chat. I haven't seen any questions come in, but I've got a couple of my own. So one thing that you had mentioned earlier, Margaret, was connecting with national resources. And I'm wondering, is a national resource likely to come up in the search if someone was to be looking, or is it just Vermont specific resources? And a national resource I'm curious about is the Disability Information and Access Line that I recently learned about. And I'm wondering if they're more likely to refer to 211 than 211 to refer back to them. But so I've just asked two questions, actually.
You did. It's okay. Let me see if I can try to answer that. When we do include national resources in our database, and again, they're vetted, and they are either agencies or national agencies that are already working through AIRS and the Alliance, AIRS Alliance. They're either members or they're connected some way. People for specific, I could maybe give an example of maybe a national resource that's in the database. One would be through, let's say off the top of my head, people calling in and trying to access mental health supports, having a hard time finding a therapist. We don't keep therapists in our database, but we do have referral agencies that might be able to help them connect with appropriate mental health services. One would be the mental health hubs, the community mental health agencies throughout the state. A national one might be something such as Psychology Today. A national agency might be something like Medicare or Social Security or the IRS. Big behemoth types of national programs that are that do offer benefit programs that Vermonters have access to. Disability, I'd have to do a little research on it, but my thought would be is that if there is a national agency that provides a service that would benefit Vermonters. Our database curators would vet that information and go through an inclusion protocol that's grounded through standards, through AIRS, to whether or not to include it or not to include it in the taxonomy. One of the links from our webpage is to certainly encourage people to submit that information to our database curators and let that vetting process begin to try to fit it into our database somehow if it's something that's meaningful and helpful for Vermonters.
Jamie, can I answer that question from the Help Me Grow point of view?
Yeah.
Yes.
So I think a good example would be something like the Postpartum Support International, which is the national entity. It's an international entity, obviously. But nationally, there is a website that is in the database and that families might be referred to. But for Help Me Grow, because we have a little bit different standards in terms of the database, we might refer a family to Postpartum Support International because they may want to participate in some of the activities that they provide online, or they might want to speak with the general helpline, but we also would offer them local therapists that are Postpartum Support Internationally trained. So sometimes there's an overlap there where we may refer to a national entity that provides some support or direction for families, but then also give them a local resource as well.
Thank you. The other question I was wondering about, Elizabeth, you had mentioned this really nice like feedback loop that I almost thought, my gosh, you guys are kind of like doing case management a little bit, where you're getting the resources and you're connecting with the family with permission, and then you're circling back with the provider. And I wondered, Margaret, if 211 also has that kind of feedback loop, or if it's kind of specific to Help Me Grow. I'm wondering because maybe there's not the same volume of calls coming in, but I was curious about.
I could certainly let Elizabeth add to this if she, what our experience is here at 211, we do provide certain levels of follow-up and advocacy when needed. It's a little, we have a certain protocol around that. Help Me Grow is more specialized. They are involved with that wraparound approach to helping families get that more intense level of need met. Our role is to strictly help people connect to different resources. If there are barriers, if people call and say that they applied for a program and were turned down, that they didn't meet eligibility, but weren't really given a good explanation as to why, or if they're trying to connect with an agency and struggling with connecting to an agency and getting services, or for whatever reason, we will offer a level of advocacy, but it's a little more intense, it's a little more in depth, but it starts with permission from the caller. At some point, sometimes we will reach out to the service provider or the agency in a non-judgmental, non-threatening way. It's just a kind of a gentle conversation about what we're hearing and what we're experiencing from a particular caller. And is there anything that we can do to help make this connection a little easier? Or is there information that we can share with the caller or the person who reached out to us to help them get connected to this particular service or maybe another service? Or it's a little different, but we categorize it as follow-up and information and advocacy. We don't do a lot of it. There is a protocol around when those times, when that level of communication is needed. And it's usually held to people who are more seasoned and more experienced in the call center. Does that help?
Yes, thank you.
Okay.
So I don't see any questions in the chat, so this might be a good good place to end. So I wanted to say thank you so much to both you, Margaret and Elizabeth, for today's informative workshop. Everyone will see a link to an evaluation in the chat. If you could please take a few minutes to complete it so we can make improvements and fulfill our grant requirements, that would be greatly appreciated. We do have more interesting workshops coming up, and you can find details about those on our homepage of our website, which is vermontfamilynetwork.org, along with the links to the previously recorded ones. We have tons of information on our website, and getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you are a parent. We have 2 closed groups, one for all parents of children with disabilities and special health needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel. We're here to help. Please contact us by phone or email. And thanks again, everyone, and have a great day.